Welcome back to RNPN Tutors USA. Today we're going to talk about Abruptio Placentae. Abruptio Placentae is a condition that happens in maternity nursing. Basically, we're caring for a mom who has a separation of the placenta from the area of implantation. So usually we prefer, it's more ideal for the placenta to attach higher within the uterine cavity. In this case, mom's placenta is separating or tearing off of the walls of her abdomen. Now, if you think about it, if something is tearing off inside of you, this is body tissue, this is going to be painful. There's another condition that's very similar, that's placenta previa. Placenta previa is generally painless, bright red bleeding. We're talking about Abruptio Placentae. And with Abruptio Placentae, mom has darker red bleeding and usually very sharp abdominal pain. The abdomen actually changes shape and may move up or out or get more pointy. It changes shape because blood is pooling within the abdomen. Mom might also have uterine contractions, generally because of all this blood loss, and especially blood that might be pooling, because not every time we see the excessive vaginal bleeding with an abruption. So what can happen with Abruptio Placentae is that mom is losing blood, but blood is pooling on the inside, and mom will present with the signs and symptoms of shock. So mom might have a change in pallor, be more clammy and sweaty, diaphoretic. Mom will also have a change in her vital signs. This is why vital signs help us so much. Mom might become, remember we said shock, so she would be more tachycardic, more increased pulse, but would be having a drop in blood pressure. Another thing to, of course, remember is that we also have to monitor for fetal distress. The placenta is what brings blood and nutrients and helps to maintain the pregnancy and maintain this fetus. And so if we have the placenta separating, we also have a loss of nutrients and blood flow. And so we have insufficient circulatory flow and nutrients to our fetus. And so we may see fetal distress. If you think about it, it might be more so bradycardia in the fetus. Remember that if mom presents with this sudden sharp abdominal pain with the dark red bleeding, we do not do the vaginal examination. Normally we would do a sterile vaginal examination to assess our pregnant woman, but in certain cases we don't. This is one of them, because we do not want to cause any further injury or fetal distress. We want an ultrasound to help us differentiate what is happening to our mom. Now, some of the interventions that we can do with a pregnant woman who's having Abruptio Placentae, of course, we need to have IV access, large bore preferably, because we're going to need to re-expand mom's blood volume. We probably will be monitoring different things. Of course, the vital signs. We'll be monitoring mom's hematocrit, hemoglobin. We want to also monitor her platelets, because what can happen in a situation like this is the body will try to respond to the separation of the placenta. And what happens is this interrupts the coagulation processes. And so because of this excessive bleeding, many times the body tries to respond and will release platelets. And remember that our platelets then get released, trying to go to the site of injury. And so we lose our circulatory platelets. And so platelets will drop when we do our lab studies. Another thing to understand is that if mom is having this Abruptio Placentae, you should be thinking that we're prepping mom for a C-section. Another thing is to monitor our fetus as we're prepping mom. Remember also that we would be preparing blood products, fibrin, fibrinogen, things like that, because mom might also be developing a problem called disseminated intravascular coagulation. What we mean by DIC is that what happens is the body's aggressive response to stop this bleeding will also cause mom, the platelets that we spoke about being released, will start to have mom forming tiny clots in our very, very tiny blood vessels and capillaries that will also further reduce blood flow, and so mom further goes into shock. Another problem is while that is happening in the tinier blood vessels where the clots are forming, mom is also having excessive bleeding because of the reduction in platelets and the changes in her coagulation. So our interventions again include IV access, preferably large bore. You want to monitor vital signs. You want to consistently monitor the fetus. We have to do fetal monitoring, monitoring fetal heart tones, monitoring how well the fetus is doing, we have to prep for a C-section. Mom is going to have to generally have emergency C-section if, depending on the extent of the abruptio placentae. Remember, this can present with or without vaginal bleeding. We have to get the baby out because there's nothing to support the baby. So again, we're monitoring platelets because of course circulatory platelets would possibly go low in response to this because the body's trying to correct. So again, abruptio placentae, the placenta separates from its area of implantation. Mom has sharp, sudden abdominal pain. The bleeding, if it presents, is usually darker and red. The abdomen is more board-like, it's more painful, and mom may even have uterine contractions. So hope you enjoyed this video. Check us out, we have other videos. Also check out our website, it's RNPNTUTOR.com. If you're a nurse already, you can get your continuing education CEs there. You also can book a tutor if you're a nursing student and you need assistance. So join us again for another video. Don't forget to like, share, subscribe, and also comment and let me know what other areas of nursing you would love for us to cover. Thanks for watching.